85% of PEPFAR is functional right now. I know there was some hiccups on the payment systems, not the waivers, the payment systems, which I acknowledged in conversations with many of you, but we have fixed that program.
What I see in young people now is that they're facing an uncertain future.
I think it's just more difficult to be a youth today because the impact social media can have on the mental well-being.
Youth are facing a lot of information thrown at them.
We wanted young people to take their lives into their own hands so they can have a voice.
We need the opportunity to show the job we can do.
Even though you're just one person, you're just one high school student, you can still make a meaningful impact in your community.
I wanted to do anything and everything to make sure that youth had a voice. Every voice has amplification.
We were small and scrappy, doing things to really make a difference.
My name is Shaman Muhammad Jr.
We thought, wow, there is a connection between climate change and HIV. So we created Spread Trees Not AIDS. So we wanted to take an action-oriented approach.
KwaZulu-Natal was kind of this test of it.
It was always a goal of ours to do it internationally. It just blew my mind that we could do this.
People from around the world coming together to create the No Time to Wait conference.
I started educating youth, doing workshops about HIV.
Youth are not only future leaders, they're the leaders now.
Going to the community.
That is Nick, that's happened to me.
Thank you for listening to my story.
At that moment, my dream became more valuable to fight for.
Can you raise your hands if you're a volunteer at Let's Stop AIDS?
Hello, everyone, and welcome to the Winning Seed 2026 live stream. We are so happy to have you all joining us as we continue this incredible competition and celebrate youth innovation in youth health and advocacy across Canada. My name is Serena Akhtar, and I am the project lead for the Winning Seed at LetsStopAIDS. I have the pleasure of hosting today's event, and we are so grateful to have everyone here with us, whether you are joining virtually from home, schools, workplaces, or tuning in with others. I want to first begin with a land acknowledgement. LetsStopAIDS acknowledges that we operate out of Toronto, as covered by Treaty 13, signed with the Mississaugas of the Credit. As well, we also acknowledge the Williams Treaties, signed with multiple Mississauga and Chippewa bands. As settlers of this land, we want to acknowledge that this is the traditional territory of many nations, including the Mississaugas of the Credit River, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Huron-Wendat peoples. We want to recognize that this territory is part of the Dish with One Spoon Wampum, a treaty made between the Anishinaabe, Mississaugas, and the Haudenosaunee, where nations agreed to protect the land and responsibly care for its resources in harmony together. All those who come to live and work here are responsible for honoring these treaties in the spirit of peace, friendship, and respect. We also acknowledge that LetsStopAIDS does work across the land we call Canada, in the traditional territories of many nations, and that we have folks attending this event virtually from many lands. As we gather here today, these First Nation people continue to experience ongoing colonization and displacement, where land acknowledgements are offered in place of land itself. We must take the time to reflect on the ongoing responsibilities we have as allies to learn, acknowledge the harms of the past, and to consider how we can each try to move forward in the spirit of reconciliation and collaboration. As a first step, during our judging break today, we encourage you to spend some time looking up and following your local First Nations, Métis, and Inuit organizations and leaders, especially those in the HIV sector, such as CAN or OHAS. We need to support our communities in every way we can. As we move forward, I am excited to share that we have an incredible lineup of youth leaders today who will be pitching their innovative and creative youth health-related projects with the goal of having zero new HIV transmissions by 2030. For over 21 years, LetsStopAIDS has been driven by youth leadership, youth advocacy, and empowering young people to play an active role in the HIV response and create meaningful change in their communities. The Winning Seed invites youth ages 14 to 29 to propose project ideas addressing youth health-related issues, with a focus on sustainable development goals from the UN, which include SDG 3, good health and well-being, SDG 4, quality education, and SDG 10, reduced inequalities. Today, we have shortlisted 4 teams who have been selected for their outstanding pitches supporting youth health and advocacy in their communities. Each team will compete for first place, where the winning team will receive a $1,000 microgrant in seed funding to kickstart their project, along with a $500 cash prize. In addition, we have some incredible industry experts who will support the winning team through a year-long mentorship cycle. Each finalist team will present their project, followed by a Q&A with our judges. After all presentations, we will take a short break while the judges deliberate, and then reconvene to hear the final results. We also will have a short break after our second team, which we will announce following their Q&A. Welcome, everyone, and let's learn more about who we have here today. This year, our incredibly talented finalists are 1. Chad Huang with Safer Sex HQ. Chad is a volunteer at LetsStopAIDS who works with our peer education workshop program, P2P. His project, Safer Sex HQ, is a web platform that connects people to sexual health resources faster and more easily. Welcome, Chad. Second, we have Justine Ho with Breaking the Silence. Justine is a senior high school student who volunteers weekly at local youth programs, mentors students in STEM, and is passionate about health education. Her project, Breaking the Silence, consists of youth-led workshops designed to address stigma and improve education around sexual health and prevention. Welcome, Justine. Third, we have Shrenika Malgan with Sahara. Shrenika is a student leader, advocate, and founder dedicated to youth empowerment. Her project, Sahara, is an initiative reaching untapped cultural communities through mentorship, resources, and support to foster confidence, inclusion, and opportunity. Welcome, Shrenika. And our final team, Lisa Chen, Safa Farah, and Arda Erbayev with For Youth by Youth. This team works together as peer support workers and volunteers on the Ethnocultural Youth Advisory Committee based in Ottawa, Ontario. Their project is an awareness, stigma busting, and system navigation initiative empowering youth to access care for HIV and AIDS. Welcome, Lisa, Safa, and Arda. Now, I know I've been talking for a bit, but I would like to introduce our incredible mentors and judges. After each introduction, I will invite the judge to share a brief 30-second message with our viewers, finalists, and everyone watching this call. First, although not on this call, we want to thank Madeline McCall for being our communications mentor for the Winning Seed. Madeline is a creative artist who works as a video journalist for Global News, where she produces daily videos that capture stories in the community. She graduated from Western University with a BA in Media and Public Interest and a certificate in Digital Communication. We're excited for the winning team to be under her mentorship. Now, I would like to highlight our first youth judge, Yumna Hussain. Yumna is a coordinator of the Center for Safer Sex and Sexual Violence Support at the TMSU, with years of experience providing trauma-informed support to youth through education, advocacy, and prevention in the sexual violence sector. I now invite Yumna to the stage. Speak.
Hello, everyone. As Rena mentioned, my name is Yumna, and I'm excited to be here today As a youth judge, I see a lot of needs for grassroots approaches to youth advocacy in my work, and I really admire and love that this competition embodies that and hopefully inspires youth to create and engage and change more. Thank you.
Perfect. Thank you so much, Yumna. We now will go on to our next judge. Jasper, are you ready?
Hi. Yeah. Hi, I'm Jasper, and I'm grateful to be here as a mentor as well as a judge today. I'll be looking over for your finances, and I'll be helping and guiding you in the future, as well as I'm looking forward what are your ideas and how it can affect society in a better place.
Okay, perfect. Thank you, Jasper. I will now have our second judge, Damaris, if you could speak a few seconds for us today.
Hi, everyone. I'm happy to be here today. I'm really grateful and happy to have the opportunity to be part of the Youth Health Advocacy Mentors and Judges today. And I look forward to hearing what all presenters are going to be presenting in regards to supporting young people in the community. I'm really passionate about adolescents and youth, and I really look forward to hearing from them. Thank you.
Amazing. Thank you, Damaris. We'll now have Daniel speak for 30 seconds.
Hello, everyone. It's great to be here. This is my first winning seed as a team member at LetsStopAIDS. I'm looking forward to hearing you contestants, and good luck.
Amazing. And now we're going to go over to Vicky, our last judge. Vicky was actually one of our winners from the 2024 winning seed with her Rap Plus Swallow initiative. We wanted to congratulate her for coming back and being more involved as well. Vicky, you can now have the stage.
Yeah, so hey everyone. As Serena said, my name is Vicky. I remember to all the finalists there, I remember being in your shoes in high school. I was really nervous presenting to everyone, but trust me, it's gonna be fine. I'm really excited to see what you guys have in store for us today.
Amazing. Thank you to all my judges for sharing your thoughts. Now, let's move on to the exciting part, the pitches. A reminder that each finalist will present, followed by a short Q&A with our judges. As they present, I ask all virtual viewers to feel free to share your thoughts and support in the chat. We will also be following a designated speaking order for both presentations and Q&A. Now, let's hear from our first finalist, Chad Huang with Safer Sex HQ.
Awesome. Thank you so much. Healthcare shouldn't be hard to find. I'm the founder of Safer Sex HQ, an intelligent clinic connector and resource hub. And I built Safer Sex HQ because of my lived experiences and also from what I've seen as a volunteer here at LetsStopAIDS. So the problem is real. 56% of people that I've surveyed actually we found that, sorry, excuse me, the slides are a little small. Delayed testing because it didn't know where to go. 71% didn't trust the clinic information found online, and the LetsStopAIDS Sex Lives report found that 7 in 10 young Canadians have actually never been tested despite being sexually active. And so this is what we're building for. My validation survey, common words that came up were overwhelmed, confused, anxious, and everyone sought for a personalized experience. And so here's the solution. SSH is a clinic connector. Through just 5 questions, we find the best clinic for you. But we're not only just that, we also provide this scenario guides for PEP, PrEP, and exposure decision support. We also have conversation scripts for partners and healthcare workers, so you don't have to navigate those conversations alone. And lastly, we have vaccine guide. Oh, is there an audio issue? Oh, okay. Lastly, we have vaccine guides. So here's a quick demo of how SSH works. So just 5 questions, let's begin. Where are you located? I'm based in Toronto. I'm looking for testing services today, but I'm also really happy to see that I can get connected with prevention, treatment, and ongoing care services, as well as gender affirming care through this platform. And this isn't super urgent, so I'm gonna look for something within the next week. And it matters most that no OHIP is needed because I'm actually not covered by any provincial healthcare programs. So, all right, let's find some affirming spaces near me. Great. It found that House of Free Clinic, which is about an 8-minute walk from College Station, is the best clinic for me. I can get directions here directly by clicking the button. I can also see what exactly to expect to kind of ease my anxiety. And also I can add it to my calendar. And so I'm going to go ahead and do just that because I'm going to go sometime next week after work. And so nothing like this exists currently. The current options provide generic lists that are often outdated with information, and there's not really a concrete action step, for example, adding to the calendar, but we actually provide that through SSH. So it's tailored to you. The clinic information is verified and current because we actually have a claim clinic function through our platform, and there are some clear next steps for you to take as well. So our target audiences are youth ages 14 to 25 who are first-time navigators of sexual health services. We also have the queer community as well, who are looking for a stigma-free affirming healthcare. And lastly, newcomers to Canada who are navigating a new system. The success metrics we're looking at are the number of people who access testing and care through SSH, the number of return visits to suggested clinics and resources, as well as the clinic partnerships as a percentage of the total clinics available to make sure that we're really tapping into the number of clinics that are available. So when we look at funding, our total cost estimate is around $462, with Lovable being at around $240 for 1 year, which is what our platform is built on, the custom domain, and also a custom email address for $12 for 1 year, which is a great deal. And also some APIs and databases are going to cost about $250. So the 12-month roadmap to actually launch in Ontario and become a successful sexual health connector here is going to start in month 1 by building and testing. So we're going to essentially build the clinic connector and test it firstly in Toronto. And then we're also at the same time going to develop resources for our library and apply for some additional grants. As scaling grows, it's going to also cost more money. And then we're going to beta launch, expand into several different Ontario cities, and really we're going to focus on improving our product through feedback. And lastly, months 5 to 12, we're focusing on growing our product and also establishing those strong clinic partnerships. And essentially by the end of month 12, I want SSH to be supported and recommended by the Ministry of Health as a sexual health connector. And that's the ultimate goal. Scaling beyond Ontario, we're looking at new transmission data. So Saskatchewan and Manitoba are at the top of our priority list. And I also want to recognize here that harm reduction plays a huge part in HIV prevention. And so that's going to be a consideration as we scale into Ontario, beyond Ontario, following month 12. So Canada is the only G7 country where HIV transmission rates are rising. And so what this means is that we need a replicable framework that can actually scale across different provinces. And that's why I think SSH would be really successful. So as a part of my process right now, I have a prototype working. And so I've documented my process for easy replication. Every clinic visited, every testing conversation normalized, and every vaccine administered moves the needle towards zero net new transmissions. So know where to go, know what to say, and go with confidence. And you can test out SA for Sex HQ using the link here. Thank you.
Oh my God, perfect. That was amazing, Chad. I know that the time up comes up and you're like, oh my God, but you did a great pitch in 5 minutes. I know that we are now going to have all the judges come on stage to ask their questions, and we'll go with that now.
So I just have a question in terms of, aside from the Claim Your Clinic feature, what other things would you be able to plan and help in terms of the website as to how to adapt to clinics when they're changing services, updating services, or adapting to new tests or anything like that?
Yeah, so what something that I built into the platform and what I plan to build into the platform is a clinic claim feature. And that's why I emphasize clinic partnerships to be so important as a part of the 12-month timeline that I have. So through this feature, clinics can make an account and essentially they can update the services. And what I also plan to do is for them to actually have the capacity to do that and also be reminded to do that is to send them reminders and yeah, essentially just really focusing on facilitating and creating that relationship so that clinics are incentivized to maintain their information on our website. And I think as we grow the platform, the more users we have, the more inclined clinics are to provide that information as well. And I think there's a value add here as well, because we can actually provide the clinics with data on how to improve their services, which I plan to actually include in my project as well. So if users can actually report, with this clinic, I found that this information actually wasn't accurate, we'll share that information with them as well, with the actual clinic, and that further incentivizes them to use the claimed clinic feature.
Thank you.
Okay, next will be Damaris that can come on stage to ask any questions. Damaris, if you could unmute yourself.
Thank you very much, Chad, for the wonderful presentation. I don't have any question really. Mine is just to congratulate you and wish you all the best. What you've presented is really nice, really awesome, and I really look forward to seeing it being implemented on the ground. Thank you.
Thanks.
That was super sweet of you, Damaris. I echo the same sentiment. Vicky, I'm going to have you now go on stage if you have any questions.
Yeah, no, I definitely second that, Damaris. I think that was a pretty clean pitch. My one concern, however, is when it comes to data privacy, how do you plan on mitigating that when it comes to, just using something that's more, like again, with the limited budget we have with the micro grant, of course, Lovable is a very accessible option. But when it comes to the nature of the data that you're handling, it's pretty sensitive information. So I wonder how you plan to navigate this process of data privacy.
Yeah, that's a great question. And so I think what I really love about our product is that it actually doesn't collect any data unless the user wants to provide feedback. So none of that information is actually needs to be HIPAA compliant. So the only questions on data that we collect is through the 5 questions that we ask. So where do you want to access the clinic? So Toronto, Kingston, Ottawa, etc. And then what are your access needs? And we don't track any user's IP. We don't collect any information like that. And I also want to note that Lovable is SOC2 compliant. They're also HIPAA compliant as well. So I'm really excited to be working with such an affordable and also accessible platform.
Yeah, that's great. I also had another question that suddenly popped into my mind. Yeah. But I feel like I've seen a lot of resources like Safer Sex HQ. I wonder, do you plan on marketing it in a different way that differentiates you guys from other resources that already exist across Toronto? Or how do you plan to put your application out there?
Okay, perfect. Sorry, guys, we're doing some tech issues. I think he cut for a little bit. Just have him back on. Is that from Chad's end?
From the tech end.
Okay, perfect. Okay, give me 1 sec. But Vicky, really good questions. I'm very impressed. I know that they're dropping like flies out here. These are the best parts about tech. I know virtual live streams. We'll just have 1 more minute to try and see if we can get Chad back on. Yes, you're back, Chad. You're back. Okay, perfect.
Great. But yeah, to answer Vicky's question, essentially how we're gonna differentiate, and I agree, that was one of my main concerns. Is well, is this gonna be anything different? I think one is the fact that a lot of the platforms I've looked at right now, there's no workflow, right? There's no, you take 5 questions and you're connected to a clinic. It's more so, it's a huge list and you have to go through it yourself and navigate through it. And I found that that was one of the reasons why Overwhelmed was at the middle of the word cloud that I displayed. People were overwhelmed by the amount of information. The people that I surveyed, they closed out tabs because they were like screw this, I don't want to look at all this information. It's too much. And also on the point of marketing it differently, I think using tapping into queer culture, I think is really important as well. Yes, we are a professional sexual health services connector, but we can also tap into the humor of queer culture as well. And so that's kind of how I plan on marketing it.
Yeah, that's great. Thanks. That's all my questions.
Okay, perfect. Then we're going to have Daniel just ask 1 quick question. We have around 90 seconds left, so let's be quick.
Okay. Well done, Chad. My question is, how close is your demo platform to your beta platform? How much work still needs to be done?
Yeah, I would say that just simply because of the Lovable platform and how I was able to make the prototype within a couple of hours. You can go test it out at safersexhq.lovable.app. And so I would say that within 1 month, I would be able to grow that, and that's according to the timeline as well. the work that needs to be done mainly is like a lot of the heavy lifting is around collecting clinic information manually myself first, contacting clinics, creating those partnerships, and that would be a lot of heavy lifting in the beginning. But within 1 month, I'm expected to finish the product and then launch the beta within month 2.
Okay, great. So it sounds like not much work is needed to take you to the next step.
Wonderful.
Thank you, Chad.
Thank you.
Slay. Okay, well, Chad, that was amazing. I want to say thank you once again for such an amazing presentation. I know there were some tech issues, but we were able to recover very quickly, which says a lot. I will now actually thank all my judges, and we will now be continuing on to our second finalist. So while we do that, I'm just going to have the next person be introduced. So we now have Justine Ho presenting Breaking the Silence. Over to you, Justine.
Hello. If you asked me a few years ago about what HIV was, I wouldn't have an answer. As a current high school senior, many classmates around me are in that position. I've heard myths like you can get HIV from a toilet seat, and no one questions it. That's why I created my project, Breaking the Silence, to empower students with accurate knowledge about HIV, reduce stigma, and promote healthy behaviors. Next slide. My project is delivering interactive workshops in Calgary high schools targeting secondary students who are at risk due to gaps in HIV education, as I believe that this stage is most important in reinforcing knowledge learned in middle school. I'll also have a student ambassador program. Next slide. While other programs like peer-to-peer cover HIV broadly, our workshops are a bit different. They're expert and survivor-led. They teach U equals U concept, which is relatively new. They focus on real-life social interactions, including relationships, peer support, and stigma. And they also have interactive activities like myth-busting games and anonymous Q&A. Next slide. For the time frame, the first 3 months will work on planning, so outreach to schools, researchers, and survivors. I've also provided a list of potential schools and contacts. Then for the next 6 months, we'll deliver workshops, and the last 3 months, we'll be training student ambassadors, which then they can sustain learning through events. Next slide. Workshops will include what U equals U means, so how undetectable viral load prevents HIV transmissions. We'll look at prevention and also stigma and social attitudes through myths, peer scenarios, and empathy exercises, as well as just where to get test and support in local areas as well, and also access to resources if people want to learn more after the workshop. On the side, I have a sample schedule of what a workshop looks like. Next slide. And then we have, for the ambassador program, 8 to 10 student ambassadors per school. They'll receive expert guided training, they'll gain leadership skills and resume building, and they'll have the opportunity to host awareness campaigns, dress-up days, school announcements, etc. So this ensures that knowledge and stigma reduction continues beyond workshops. And on the left side, there is a sample schedule. Next slide. To measure impact, we'll have pilot workshops in 2 to 3 schools, and I want to aim to reach around 500 schools each. And then we'll have post-workshop surveys where we can track knowledge increase and awareness. So on the slides, you can see I have a form with some sample questions of what we could ask after the workshop, as well as how we would track the data as well. And then another way to measure impact is through ambassadors leading events. And so the ultimate goal is to have a chain reaction in youth understanding so we can have 0 new HIV transmissions by 2030. Next slide. So for the budget, we'll have around $600 for speaker honorariums, $0 for volunteers and the venue as it's in schools, $200 for ambassador program guides, and then $100 each for student incentives and educational materials. Next slide. This project supports the United Nations goals. So for the SDG 3, with good health and well-being, it's through prevention and testing awareness. For the 4th goal, we'll have engaging and interactive learning. And then for the 10th one, we can reduce inequalities by creating safe spaces for diverse students in public schools, where we can target like minorities and marginalized youth. Next slide. So my project is also research-backed. In a 2024 Canadian study on the knowledge of the general public, only 69% knew general HIV prevention, but only 40% knew about treatments. So we can see that this knowledge decreases as we get more specific. Another misconception is that 76% of Canadians don't know what U equals U mean, and 2/3 would not be comfortable with an HIV positive individual serving them in the public. Lastly, in education, women are 2 to 3 times more likely to get tested after structured programs. Next slide. Breaking the silence empowers students with accurate knowledge, empathy, and leadership skills. By addressing myths, stigma, and social attitudes, as well as teaching untransmittable equals this, we can foster informed, compassionate youth who can lead the next generation towards zero new HIV transmissions by 2030. Thank you.
Thank you for sharing your project with us, Justine. I'll now hand it over to the judges for questions. Again, for our viewers, feel free to share thoughts in the chat.
Thanks, Justine. My question is, do you feel that with the structure of the workshop, the content is specific enough to fill in the knowledge gaps that you've mentioned?
I believe that it is because a lot of times in middle school, you learn about general information about HIV. So I've learned in sex ed about what HIV is, but I think in high school, what we're targeting is we want to make it more specific, but we also want to reinforce that knowledge learned in middle school, and especially maybe even introduce new concepts like undetectable equals untransmittable, because that's something that I didn't even know before researching it.
Thanks for the answer.
Okay, I think Damaris is next. If you have any questions, you're welcome to share.
Thank you very much, Justine. A lovely presentation. It really caught my eye, especially looking around how I'm invested in passing out the right information and fighting away the myths and misconceptions around HIV and U is equals to U, as you've mentioned. My question is just very simple. What makes breaking the silence U is equals to U different than most other, let's say, innovations that are also have workshops that go around schools? What makes yours different?
So I was looking at the workshops like in Canada and around my city. So for example, we have peer-to-peer, which is a really cool workshop, and they do cover a lot of HIV things, but they also don't have like specific workshops where we have experts and survivors. That's the main component. And even just in my city itself, so peer-to-peer is like in Ontario versus in Calgary, there really isn't any workshops targeted to high school students itself. A lot of times it's more for like adults. And I believe that if we target high school students, we can create that, chain reaction understanding where youth can, pass on that information in the future.
Okay, and lastly, just a quick one. You mentioned that women are most likely to get tested. So during your workshop, what information are you sharing with the men or young boys in regards to actually going for tests or being aware about their status to improve and increase the numbers of comparing women and men who are being tested?
Could you repeat that again?
So my question is, in your workshop, have you incorporated activities or information to help increase the number of men who will get tested? As you mentioned, there is a gap between men and women getting tested.
So the first thing I saw in my data was that actually a lot of gay men have, or like just men in general, have actually like a higher chance of spreading HIVs, which was really interesting, which I would highlight in the workshops. But another thing is we would work on real life scenarios. So for example, we would talk about maybe what would you do if your partner wanted to get tested, or the stigma around talking about HIV with your friends. And so by working with like real life examples, it will be able to target everybody, even men and not just women in general.
Thank you. All the best.
Okay, perfect. We'll now have Vicky onto the screen.
Yeah, hey Justine, that was a really good pitch. I guess my one question is, it's kind of funny when I think of like don't get me wrong, I really liked the ambassador approach, but what I really find funny about it, and I think you would too, would be like, there's a lot of stigma happening in classrooms. How would we get ambassadors willing to be on board to fight that stigma, given how much stigma already exists. Like, that's like a really funny like thought experiment I kind of had mid-pitch. So I was wondering, like, do you have any incentives planned for ambassadors to join your program, or how have you thought about this sort of incentive structure for ambassadors?
That's a really good question. So some incentives would be like, it's a really good leadership opportunity. This is something that, hasn't happened in Calgary actually. And then also it's really good for their resumes. Regarding like getting people to be volunteers or student ambassadors, I know that in my school we have a women empowerment club that would love to help. We also have a leadership team, which they do a lot of awareness events around the school. And then I know that we can also collaborate with other schools, with their student councils to do this as well, because this is not something that's common, right?
Yeah, that was exactly what I needed. Thanks, Justine. Good luck.
Amazing. We actually have 2 more minutes, so we can have either Daniel or Jazz. I think whoever would like to say anything. I'm seeing Jazz is saying no, so we'll go with Daniel to be on screen, just to have a quick question.
Hi, Justine. Thank you for your presentation. My question is, what existing relationships do you have with decision makers at schools currently in order to get the program up and running, the workshops?
Okay, so regarding how I would do this is I have connections with like my school. I already said before, the Women's Empowerment Club, and I know they would love to help because they haven't done much like this school year, as well as my leadership team. And then regarding how I would like contact people. So for schools, actually for the Calgary Board of Education, there's a page where you can request to have community events. So that's how I would contact them. And then regarding like, survivors or educators, I would probably contact them through nonprofits like SafeLink Calgary, HIV Community Link as well, to get educators from them. And then from research themselves, I could contact them through UFC, which is the University of Calgary, as well as if I wanted, even if I had like a backup plan, that would be to contact people who have been on the news in Calgary as well, who have shared their story, and I could offer them to keep sharing their story so that people in high school also know about it.
Thank you.
Oh my God, that was very informative. I'm so glad that everybody got to ask their questions. Justine, thank you so much. I want to say again, thank you to both our presenters so far. We will now take a short 5-minute break. For anyone watching and for all our contestants, please feel free to step away briefly. We will be back shortly. Welcome back, everyone, and thank you for staying with us. I know everybody had to take a 5-minute breather. We will now continue with our next finalist, Shrenika Malgan, presenting Sahara. Over to you, Shrenika.
The name Sahara means support or guidance in Urdu and Hindi, a helping hand when you need it the most. And that's exactly what Sahara is, a youth-led HIV prevention ecosystem for Canadian youth aged 15 to 24. This complete system brings together a confidential AI chatbot and prevention kits, giving young people accurate sexual health information, trusted guidance, and tools they can actually use. I started Sahara because as a high school student and a person of color with strong cultural roots, I saw firsthand how cultural taboos and fear of judgment stop youth from asking important questions about sexual health. The Sex Lives report shows that 63% of youth feel school sex education did not prepare them for real-life scenarios, and fewer than 5% remember learning about HIV prevention tools, such as PrEP. At the same time, many youth rely on the internet for information, which is often very inaccurate. These gaps make Sahara's AI chatbot essential. The chatbot lives on the Sahara website, built using Base 44, which allows us to make a secure, mobile-friendly site quickly and update it easily without a huge development team. Youth can access it on phones, tablets, or computers, devices that we look at every single day. The chatbot is GPT-4 powered, providing real-time, personalized responses. With Sahara, I can ask any question related to sexual health, privately and safely, and the chatbot will give me medically vetted answers co-created with youth advisors so that the language is friendly and relatable. Other health chatbots like WooBot for mental health or Ada Health for general guidance are helpful but not really designed for youth sexual health, and they don't address cultural taboos or local resources. Sahara is different. It's built for Canadian youth, culturally sensitive, and can refer users to telehealth services or partner organizations when needed. Our content is reviewed by NGOs like LetsStopAIDS, YouthCo, and Katie, as well as cultural communities, ensuring it's trustworthy, medically accurate, and culturally relevant. The chatbot follows Canadian privacy laws, doesn't store personal information, and all the trends are completely anonymous, so young people can ask questions safely while our system evolves with usage. For this one-year pilot, we're running it on a small but efficient budget. $300 goes towards our website to make sure it's secure and easy to use, $200 goes towards running and improving our chatbot, and $500 towards our prevention kits. Alongside this chatbot, Sahara provides prevention kits. Each kit contains condoms, dental dams, culturally relevant brochures, and referral information. The kits are designed to complement the chatbot. They can access the right tools for real-world scenarios immediately through a kit at a school or a youth center. This creates our complete ecosystem. Partnerships are key to Sahara. We will work with NGOs, schools, and cultural organizations to ensure youth get guidance they can trust. NGOs like LetsStopAIDS, YouthCo, and Katie provide credibility and medically informed content, while schools and youth centers will help with distribution and outreach. Cultural organizations make sure our materials are relevant and respectful. Our partners will gain meaningful incentives. NGOs and cultural groups expand their impact and connect with youth, while schools build trust with their students and their parents. All partners benefit from recognition and strengthened community presence. Youth engagement is central to Sahara. Young people co-create chatbot content, test features, design kits, and lead outreach. Of course, I can't do this all alone, so a small volunteer group will help implement feedback and manage day-to-day activities. These volunteers also receive meaningful incentives such as mentorship, skill-building opportunities, and recognition for their contributions. Together, partnerships and youth engagement create a sustainable ecosystem. It's a win-win for everyone. During this one-year pilot, we'll launch the website, co-create content, test the chatbot, and kits. After our pilot, we can evaluate impact and revisit our goals for next steps. What does Sahara's future look like? We want Sahara to expand across Canada, with youth leading our work. New sponsorships and grants will support growth of the platform and our prevention kits, ensuring more young people can access safe, accurate, and culturally sensitive guidance. For me, Sahara is more than a platform. It's a way to make a real difference for youth like me. It's about creating space where young people can access questions safely, get accurate guidance, and access tools they can actually use. This one-year pilot is just the beginning, a chance to learn, grow, and build something that can truly expand while keeping youth voices at the center. Thank you.
Wow, Shrenika, that was beautiful. Thank you so much for sharing about Sahara. I will now hand it over to our judges for questions, starting with Yumna.
Thank you so much for the presentation. I think at this point I don't have any questions.
Thank you.
Okay. That was a very quick question. Okay, next we have Damaris.
Thank you very much for the wonderful presentation. This is quite an interesting platform that you're sharing, especially looking at the ages that you're targeting. I don't know if mine is a question, but it's just kind of a concern. In terms of monitoring the chat box, the questions and the conversations that go around it, will there be active monitoring looking at a scenario where someone might be suicidal due to any issue or have any issue that really needs urgent care or services? Is there monitoring around that? And then also in regards to referral, have you linked the chatbots with, let's say, referrals to the nearest clinics or other services that one may need? Thank you.
Yeah, I think I should have made that a bit clearer in my pitch, but that is a really big concern. You know, people in these situations often have need urgent care. So I think the chatbot would be trained to immediately refer you to a phone-based guidance or a telehealth service or a clinic that would help you urgently and in a much better way. So I think I should have made that a little clearer during my pitch. Thank you for the question.
Thank you and all the best.
Wonderful. I will now have Vicky onto the screen.
Hi, Shrenika. Yeah, that was a really good pitch, and I really like the tech-based approach. My one question was, okay, because you seem to be pretty familiar with tech. Now that we looked at ChatGPT and we see that, you know, the models are getting trained faster and the iterations between each training cycle is getting shorter and shorter, these models are really good at scouting for new information. So I was wondering, like, what would make or compel a group of people to use Sahara over something that has, you know, immediate access like ChatGPT, Claude, etc.?
Yeah, so I think that was what I was thinking about too. I think the difference between ChatGPT and Sahara would be ChatGPT only has access to websites and forms that they see on the internet that exist already, but there are a lot of concerns and a lot of like religious and cultural communities, and they all have different taboos and myths that aren't often published on the internet. So I think co-creating and vetting our information with our partners, like our NGOs and our cultural communities, makes it a bit different because we're getting information from the source instead of a secondary source like a website, like what ChatGPT would do.
Interesting. I guess my follow-up question for that would be, how exactly will these cultural groups be consulted with when training the model, and which specific cultural groups, and what will determine why Sahara would be targeted towards one or the other?
I think we would start off with, personally, I think I would, you know, reach out to my cultural community because I am associated with that, but I would like to expand it so that we would touch base with different cultural communities, because I think each cultural community has different myths, and that was kind of my main target. I know I experience a lot of different taboos that aren't often real, so I think really touching base with those communities, only if they're comfortable with it, of course, because I know a lot of the biggest concern about the biggest problem that we found when creating Sahara was that a lot of cultural communities don't feel comfortable sharing about it. So I think really encouraging them, checking if they're comfortable, and then helping, and then taking their feedback and information and putting that into our chatbot.
All right. Yeah, that's all I needed. Thank you for your answers.
Wonderful. Wow. Look how amazing this sounds. I actually have a YouTube comment that actually asked a question. We're not going to have that on screen. Who owns the health data via chatbot? Is there a way to isolate or make it private?
Yeah, so we do, the chatbot would follow all of Canada's privacy laws. So when I was studying it, I actually found out that when you are getting feedback from a chatbot, it doesn't actually look at your specific like person to response. It more looks at anonymous trends. So what questions are more frequent? It doesn't data analyze the conversations, more the questions that are being asked, what types of questions, and it definitely doesn't associate it to a specific user.
Okay, and then we have one more. You're very popular. So how does the platform build trust with users who may be skeptical of AI? And would there be an option to speak to a real person?
Yeah, so I was thinking for the future of Sahara, I would definitely want to expand it to phone-based guidance. So you would start off by having your conversations with your chatbot, and then they can refer you to a telehealth or phone-based guidance that would direct you a bit better. So I know you always need that human component, and that's what the future of Sahara looks like, kind of getting that phone-based guidance on board as well.
Okay, amazing. Thank you for answering all these questions. It's so exciting to see people are actually asking in the chat and that they're watching the live stream. We have one more question that we have available. Jess or Daniel, do either of you? Okay, Jess, I see that you want to talk this time, so I'll let you have it.
Yeah. So it's a great project and I really like the name for your project. But the only question is, how do you guide user to actually take actions rather than just read information, which is
Yeah, so
available all over? Yeah.
Yeah, so I think my main thing would also be partnering the chatbot with the prevention kits. So the prevention kits would have preventative tools that would really help you action what you've learned. So I think the chatbot is just the starting to get you comfortable with having those conversations. And then they could refer you to a school or youth center that would give you those prevention tools to kind of action what the chatbot was kind of educating you on a little more.
Gorgeous.
Thank you
Thank you so
very
much. Okay, perfect. Well, that was amazing, Shrenika. I'm really, really excited to hear about Sahara more later on as well. So now that we have spoken about our 3 finalists, we are moving on to our final team. So our final team is Zinshu Chen, who's also going by Lisa, Safa Farah, and Arda Erbayev. At this moment, our team lead, Lisa, will be handling the presentation. Oh, she's so pretty. She's on screen. I'm going to have you have the floor.
Awesome. Thank you so much. I'm so pleased today to present our project for tailored HIV resource navigation in Ottawa, Ontario, our community. As background, 27% of HIV-positive test results in Canada come from youth between 15 and 29. Street-involved youth are particularly vulnerable to HIV infection, especially for youth who inject drugs, immigrant and refugee youth. Barriers to testing include fear of stigma, mistrust of the medical system, and lack of inclusive education, whereas facilitators include peer support, system navigation support, and education and awareness programs. Based on this, we as 2 volunteers and the peer support worker on the Ethnocultural Youth Advisory Council of YSB, Ottawa's largest youth charity, we primarily work out of the youth emergency shelters and the drop-in service. Our mandate is to support racialized youth in connecting to and navigating community resources while advocating for inclusive systems, including access, accountability, and follow-up. I'm graduating with my Master's of Science in Epidemiology in August, and I'm currently leading a literature review of medical misinformation, where preliminary results suggest that HIV is a primary target of misinformation that changes behaviors, like a lack of motivation to get on ART because they don't know they can make you untransmissible. In my free time, I'm also an online health communicator, with threads gaining over 30,000 impressions. Safa is a frontline staff at a substance youth clinic where she triages patients, helps them navigate the system for HIV services, and is conducting a pilot project on the correlation of HIV and Hep C transmissions. Arda is a healthcare comms officer in Health Canada, where we analyze the undetectable equals untransmissible campaign, learning how public sentiment on social media shapes health outcomes. Our last major project, Where Art Thou?, allowed us to teach youth with local traditions from Indigenous and racialized perspectives over 4 workshops and a public art exposition, thanks to a $5,000 grant from the SPCO, and some of it is pictured here. The process will involve us meeting youth where they are at. Using our research expertise, we will conduct a literature review of barriers, and using SAFA's system navigation expertise, we will find locally accessible services to overcome them. We will then seek opinions from youth we work with and find youth collaborators, using our existing relationships with youth at the drop-ins and at the youth shelters, as well as flyering and social media. With these youth, we will co-design materials by identifying the barriers most relevant locally, preferred messaging, and preferred ways to receive information. And then we will produce posters, cards, and highly searchable social media and empower youth to be their own health advocates. In getting the word out, we have 3 mechanisms. The first one is distributing posters and cards at our community health centers, including YSB services and drop-ins. We will also rely on our youth collaborators to spread word of mouth to their friends. This is going to bring in the peer motivator component. And on TikTok, we will use our expertise to create highly searchable in perpetuity resources. I once posted a TikTok on UOttawa that got 30,000 views, and there are people asking me questions to this day. I got a like on it today, and I posted that thing 4 years ago. And we are also able to be responsive and respond to organic comments, questions asked, etc., not just from our youth collaborators, but also posed on our social media. Resources that youth could choose to highlight are numerous in Ottawa. There's anonymous testing at local clinics as well as getatikit.ca. Many of the youth we work with are on Ontario Works or on the ODSP program, or they are under 24, which allows them to navigate PrEP for free. Finally, we have holistic support options, such as the AIDS Community of Ottawa, the HIV Legal Network, and CAN, which is an Indigenous-led nonprofit creating community for people living with HIV. These are just some of the resources that youth could choose to highlight. Based on what youth want to highlight, based on what information they say, hey, this would make me change my behavior. Hey, knowing this, I would then get tested. We will create culturally resonant messaging. With between us and our larger volunteer team, we can translate for language and cultural relevance into Somali, Lingala, Arabic, Mandarin, and Hindi. With our highly searchable social media, we will create TikToks, Instagram Reels, whatever resources are deemed relevant by youth, and we will have a link tree to websites that can help them navigate the system in Ottawa, as well as resources from official Health Canada networks. And our social media link tree can monitor the number of clicks. We will also be able to distribute posters and cards and have them for youth to pass out to their own friends, thus creating a network of youth empowered to crush stigma and sharing resources such as cards and social media links. Thank you.
That was beautiful. That was also exciting to hear. I'm so grateful for the work that you guys do at EXO. It's so nice to hear from that. I'm now going to hand it off to our judges to have the questions starting, but I just wanted to share.
Thank you so much for your presentation. I'm just wondering, you mentioned that youth would tend to share the information that was created. How will you engage with youth and incentivize them to be able to share that amongst their peers and their friends?
Thank you. I think the first thing is that we're operating at a relatively low level. Instead of asking them to be like a public-facing HIV advocate, they're an advocate without a title for themselves and their friends. For example, youth are aware of what their friends are up to. If they know that this is a risk factor for HIV, they might tell their friend, hey, I'm concerned about you because I'm your friend, and here is a card with resources, or here is a link to a social media post that I thought was helpful. So this is really approachable, not scary levels, and we're looking for this to be an organic chain. Like someone tells someone, and then their friends tell their friends, and their friends tell their friends. The motivation there is intrinsic. You want to help your friends.
Thanks for that.
Wow, that's beautiful. I will have Tamaris on screen now.
Thank you very much, Lisa, for sharing your presentation. I like the model, and I'm really looking forward to seeing it on the ground as most of the innovations that have been presented today. I don't have any question. Mine is just to congratulate you and wish you all the best.
Thank you very kindly.
Okay, gorgeous. Then I'm going to have Vicky on screen, please.
Hey, Lisa. Yeah, I was just wondering, like you mentioned you had a master's or like are pursuing your master's in epidemiology. Have you worked within this? I know you worked within the sphere before, but I just wanted to hear more about your past experience dealing with stigma-based awareness campaigns.
My experience dealing with stigma-based awareness campaigns specifically is more of like it's my research, like my thesis work is on medical misinformation. A lot of that intersects with stigma, and a lot of it is just things like, oh, like I don't trust vaccines because, you know, it causes XYZ injuries, or because like I don't trust the medical system. And then I have, in my free time, I'll go on the internet and I'll say something like, here's an analogy for the way that these tests are set up. If you are, the one that comes to mind right now is like, if you are testing a vaccine, you will test it against another vaccine instead of a placebo as long as one is available. If like because if you have a better bike helmet, you're going to test it against other bike helmets. You're not going to test it against nothing at all. So things like that. And then other terms of like navigating stigma and on a smaller scale, not related to my epidemiology degree, I worked with ARTA when ARTA was the coordinator for the WUSC team at U Ottawa. That's the World University Student something. It was for refugee students, and I was a health mentor. So I helped my health mentees navigate the medical system in Ottawa, as well as like conducting some workshops on sexual assault and sexual violence prevention for these students. So that is a stigma-related area.
All right, yeah, thanks. Thanks for sharing your experience, Lisa.
Gorgeous. So I will now ask if Daniel has a question to feel free to be on screen now.
Hi there. Thank you for your presentation. I have a comment just to say that I like your approach with using youth advocates. You commented that youth would like to help their friends. We actually have data to that effect that reinforces the idea that youth are most comfortable talking about sexual health with their peers.
Yes.
So I think your strategy to communicate is right on.
That's amazing to hear. Thank you so much.
Okay, perfect. And then the next person I'm going to have on screen is Jas, if you have any questions.
It's a pretty good project, and I wish you all the best. I don't have any questions for now, but all the
Thank
best.
you.
Gorgeous. If there's anyone in the chat who wants to ask a question, you still have a minute or two to do it. I'll give it a few seconds. But while we look for that, Lisa, thank you so much for sharing what you do. I think one of the best things about this particular project is you guys have the network and you have the experience. Clearly, just from hearing your words, you are very well put together. Oh, we have one that's going to come up. So I'm just going to wait till they pop it up. All right. Follow up to Yumna's question. Beyond relying on intrinsic motivation, what external or structural mechanisms are you using to sustain engagement? And if that motivation chain breaks, what systems are there? And I'm going to assume in place to re-engage users.
I think the main concern we have with regards to the social media is like that first follower effect. Somebody needs to be the one to break the ice. In this case, we have ourselves and our team of 8 volunteers, as well as I will personally volunteer my friends to comment and engage with it to create a sense of interaction with the media. And then the engagement chain comes from, there's going to be on the social media a perception of engagement because most of our posts are going to be responding to using the feature with the on TikTok, if you leave a comment, someone else can make a video replying to it. And then the next thing is that if in recruiting youth volunteers or youth collaborators to give us their opinions on what they want to see in terms of what barriers need to be busted, that is another thing that might face pushback because of some stigma. And because we anticipated that, we have budgeted with the $1,000 funding for honoraria in exchange for answering our questionnaire or looking at our materials, as well as promoting the questionnaire on social media using ads.
Okay, perfect. I know that we had 1 minute left, so you ended a little earlier. I'm so grateful for you having the time today. I know your team members were also working on this project, so I send them my energy as well. I think we have all the time to now go into Winning Seed Endgame. So overall, I know I speak for everyone when I say that everyone did a fantastic job, all of you on call. Thank you again for your pitches and for engaging in such thoughtful discussion with the judges. So in the interest of time, we will be moving forward. I want to extend a huge congratulations once again. It is incredibly inspiring to hear your ideas, and we would love to see all these projects come to life in some way or form. At this time, I would like to invite our judges to step away and join their deliberation meeting. In the meantime, we will take a short break of around 15 minutes and we'll return shortly to hear the results. In this time, please feel free to grab a drink, take a break, or watch some of the content on screen. See you very soon.
85% of PEPFAR is functional right now. I know there was some hiccups on the payment systems, not the waivers, the payment systems, which I acknowledged in conversations with many of you, but we have fixed that program.
What I see in young people now is that they're facing an uncertain future.
I think it's just more difficult to be a youth today because the impact social media can have on the mental well-being.
Youth are facing a lot of information thrown at them.
We wanted young people to take their lives into their own hands so they can have a voice.
We need the opportunity to show the job we can do.
Even though you're just one person, you're just one high school student, you can still make a meaningful impact in your community.
I wanted to do anything and everything to make sure that youth had a voice. Every voice has amplification.
We were small and scrappy, doing things to really make a difference.
My name is Shaman Muhammad Jr.
We thought, wow, there is a connection between climate change and HIV. So we created Spread Trees Not AIDS. So we wanted to take an action-oriented approach.
KwaZulu-Natal was kind of this test of it.
It was always a goal of ours to do it internationally. It just blew my mind that we could do this.
People from around the world coming together to create the No Time to Wait conference.
I started educating youth, doing workshops about HIV.
Youth are not only future leaders, they're the leaders now.
Going to the communities.
That is Nick, that's happened to me.
Thank you for listening to my story.
At that moment, my dream became more valuable to fight for.
Can you raise your hands if you're a volunteer at Let's Stop AIDS?
Jen? One more time, Jen?
This world needs your voice more than ever.
At Let's Stop AIDS, we've decided that we're going to be fearless.
Resilience isn't something that you build when everything is right. It's built when you face challenges.
Youth deserve to be spotlighted more, and everyone needs the resources to be their own advocate.
We can create a world where everyone feels valued, seen, and heard.
Every moment is an opportunity to move and inspire.
We need you to keep showing up, keep speaking out, keep building bridges, because truly, we have no time to wait.
Isn't it just so very great to be Isn't it just so very great to be 21? LSA is now an adult because of Shaman's vision, determination, and leadership.
Even as a young boy, Shaman saw how to make the world a better place, and he took action.
In 21 years, we've had 25,000 volunteers globally. Canada's largest youth sexual health survey, and it's 4 years running and counting. 1.7 million lives impacted. And from our first funding of $75 to $1.2 million annually.
The more I worked with this organization, the more I believed comprehensive sex ed is a youth right.
Never underestimate the human capacity for kindness.
Dream, believe, achieve, and lead.
If we dedicate ourselves to each other, anything is possible. All it takes is one action to make one dream a reality.
Welcome back, everyone. We will be hearing from the judges very shortly. I want to take this time to thank all the participants once again. We recognize your effort, your creativity, and your dedication to this work. Even beyond today, we hope to continue supporting your ideas and your leadership. We want to also remind each team that there are always opportunities at LetsStopAIDS to stay involved, and we look forward to staying connected with all of you. We will now hand it over to the judges to share their reflections from today in a few words, and then we'll hear from Yumna. Okay, so I will have all their reflections. Yumna will be first. Perfect. Yumna, I think your mic is off.
Thank you for that, Serena. Thank you so much for everyone who participated, and we really appreciate all your amazing ideas that you've brought forward. And it was, we had to make some tough calls, but it was really amazing to see the different variety of why youth want to educate and where they want to go with their advocacy. And it was very inspiring.
Thank you, Yumna. I'm so glad you were here. You are such a gem. Next, we'll have Vicky onto the screen.
Right. So, yeah, I definitely think that it took a lot of deliberation. We had a really good discussion, and, it was a really, really tough call, you guys. So I really hope none of the results discourage you guys. I think you all did amazing. But there were some clear winners in terms of, technical feasibility and overall consideration of the constraints that were involved with the Winning Seed project that everyone built. And should I go on to beginning announcing the first place winner for now, or?
No, we're just going to do reflections, and then I will prompt you guys all back.
Oh, okay, yeah. That was my thoughts for everyone's projects. Good luck, you guys.
Perfect. Thank you, Vicky, for your words. We're now going to have Jasper on screen.
Yes, it was all the 4 projects were very great. Congratulations for being the finalists. That's a pretty good job as well. But it was a tough call between choosing all 4 of you, but I hope it turns out pretty well how your project will go and outrun each one of us. Thank you.
Thank you, Jas. Next, we have Damaris.
mine is just to give a round of applause to each and every finalist. You have done amazing work, and I could see the passion through your presentations and the youth force. Actually, you really amazed me, and I wish you all the best. Let this not be the end of it. Please push on your innovations, and as you mentioned, reach out to more young people. And I wish each and every one you all the best. As the other judges have mentioned, it was quite a difficult decision, but this is not the end. I'm looking forward to seeing every innovation taking place and also seeing the results that come out of it. Thank you.
Gorgeous. And now we have one more judge to share their reflections, and then we're going to go right into the planning for whoever placed. So Daniel, you have the floor.
Okay, so congratulations again. There were dozens of, I guess, pitches that were considered for the finals. So just to make it to the final four is a real accomplishment. And each project, there was a case made for being the first place finisher. So that reflects the good jobs all of you did. Thank you.
Amazing. All right. Thank you so much, all my judges. I will now be announcing our winners in terms of who we have asked to be on the stage. So I think what we're going to do is we're going to have all the judges come off that aren't speaking and have all the contestants on now. So once we move on, I just want to say this year has been filled with so many talented individuals, and we are so incredibly impressed, not only by today's finalists, which all of you guys should be patting yourself on the back for, but by all the submissions we received. As Daniel said, we had over dozens of applications, and we had these incredible pitches that came through. We also have our incredible judges. Yumna, Damaris, and Vicky will actually be presenting these awards, so I hope that you have a great time. I don't see chat on screen, so I'm just going to ask my technician just to check. Before I shift to them, we at LetsStopAIDS are excited. I don't see him on the screen, so I'm just going to double check. But yes. So we at LetsStopAIDS are excited to share to our contestants that we were able to secure some funding for other place prizes. So second place will receive a participation prize of $125. Third place will receive $75, and fourth place will receive $25. It is a small token from our organization to thank our finalists for their time and for showcasing your incredible advocacy by being here today. That being said, I know that you're tired of me speaking, so I will now invite Yumna to announce our fourth place finalist team.
Thank you, Serena. As we said, it was a close call, and I really do want to reiterate that everyone who participated has come so far. Fourth place goes to For Youth by Youth.
Awesome. Thank you so much. Okay, thank you again. We're very excited to hear more about EAC, and also keep in touch. We definitely want to talk to you more about your programs. So I will be asking Damaris to announce our third place finalist team.
Thank you very much, Serena. Once again, congratulations to each and every one of you. Congratulations to you. And third place goes to Sahara.
Wonderful. Yay. You can't hear. Everyone at the office is cheering for you guys in the back. Congratulations, Sahara. For Sahara, from Shanika, yes. All right, so I will now continue on to Vicky. Vicky will be on stage, and she will be announcing the second and first place winner. While she gets on screen, again, congratulations to everyone.
Right, so again, it was a really tough call because all of you guys had such amazing ideas, but when it came down to, the technicalities and the tiny details, what really differentiated you guys were just the tiny constraints that we had to consider as judges. So even though we'd like for all of you guys to have the $1,000 grant, we did have to decide on a first place winner, and that was Safer Sex HQ by Chad. It was just a very efficient solution and something that's very deployable for clinics. The only concerns that we had were, figuring out all the data that you'd have to deal with in that process, given the volume of clinics in Toronto and all the information they get. But other than that, we decided that Safer Sex HQ was the winner today. And in terms of second place, that went to Justine for breaking the silence. We really liked the survivorship-based peer group programs that you had considered. And yeah, we're looking forward to seeing it implemented across schools in your area. Congrats, you guys.
Okay, wonderful. Huge congratulations to all our finalists and winners today. From everyone at LetsStopAIDS, we are excited to see where your ideas go next. I would like now to invite our teams to share a few words, if you have any. If you don't, you are welcome to also pass. Before we move on to my final remarks, we will begin with Lisa.
Yeah, I just want to say it was an excellent opportunity. We had a lot of fun considering what could be done to stop AIDS in our community. And I'm sure that myself, Safa, and Arda, we're all interested in collaborating more as volunteers with LetsStopAIDS in the future.
Thank you, Lisa. That's music to my ears, and I will be sending you a link as soon as this finishes. We will now be inviting Shrenika to the stage to speak a few words.
Yeah, thank you so much. It was an amazing opportunity. I think I learned a lot about actually getting into the nitty-gritty of deploying something and kind of having that initiative going on. And I loved everyone's presentations. They were absolutely very insightful, and I'm so excited to volunteer in the future with LetsStopAIDS. Thank you.
Wonderful, music to my ears. I love everyone saying they want to volunteer. If you guys can't read the chat, but there's so many people telling us from our little HQ here to have all of you there. So thank you so much. I will now ask our second place winner, which is Justine Ho, to the stage.
It was such a good opportunity just to see, like all the youth around me having such creative ideas. And I really liked everybody's idea, and I can't wait to see Chad's idea come true.
Well, Chad, I think there's never been a better segue for you to be on stage as well. So I will have you on. Thank you again, Justine.
Awesome. Yeah, thank you so much for the opportunity. Really excited to launch this project. And it means a lot because it was very largely based on my own lived experience of navigating the sexual health care. But yeah, excited to continue volunteering with LetsStopAIDS as a peer-to-peer volunteer. And thank you to the judges and to the other contestants for being out here and inspiring me.
Well, I think that goes to show we are so excited and grateful again to all our contestants for all the time that you've given and for all the pitches you have. To our winning team, Chad, please note that you will be joining a separate meeting link, which will be shared shortly to your email to discuss next steps and start scheduling times after this meeting. Before we wrap up, I want to thank everyone again from our staff and volunteers at LetsStopAIDS who made this event possible. To all of the incredible organizations, mentors, and supporters who contributed to this program in some way or form. Thank you to all our audience members for joining us today, and a big, big thank you to all our contestants this year, including those who applied and their courage to share their wonderful ideas with us. Without all of you, there would be no winning seat. A quick mention for anyone watching, we do have virtual, hybrid, and in-person opportunities open for youth advocates hoping to be more involved in our conversations around youth health and advocacy in Canada. We will be posting a link in the chat for our website, www.letsstopaids.org, for anyone interested in being more involved in community programming. Whether you want to learn more about our Youth Health and Advocacy Summit, No Time to Wait, or our incredible peer education, sexual health, P2P workshops, there's a lot of different ways to show up for your communities. We also have our Sex Lives report launching this April 10th, 2026, in 2 weeks, a resource we think everyone should know about. Congratulations once again to everyone involved. Thank you all for attending, participating, and supporting us by being here today. We hope to see you again soon. Take care and have a great rest of your day. Bye-bye.
Up next is someone who illustrates how youth can really make a difference. Shaman started his own AIDS Foundation when he was just 15 years old. He's the perfect example of someone who acts locally but thinks globally.